My name is Maura Nitka. I am an assistant clinical professor in the College of Nursing and Health Professions in the Department of Nursing. I have been a pediatric nurse for the past 30 years, practicing primarily at the Children's Hospital of Philadelphia, so locally. My specialties within pediatric nursing include pulmonary medicine, GI, focused, as well as most recently care for the complex patient, and particularly care for those patients as they return home to their communities. What brought me to the College of Nursing and Health Professions at Drexel was the desire to teach future nurses. My family member was in nursing school at the time, and I recognized the need for skilled faculty to teach the next generation. And so I embarked on a graduate degree in nursing education and ended up at Drexel in an adjunct role, which ultimately evolved into my assistant clinical professorship now. So related to my teaching, I teach a wide variety of courses across the undergraduate curriculum for nursing here at Drexel. I focus primarily on pediatric nursing, but I also frequently teach in the research course. I also am the chair for the genetics course within the CNHP. It's an interprofessional course should other disciplines wish to take that particular genetics course in their program. So my research right now, I'm currently pursuing my PhD and anticipate soon completion of that. And my research focuses on interprofessional competencies, particularly related to communication in inpatient and outpatient settings.
Great.
So I became a nurse primarily because I had some family members that had complex conditions related to childhood at the time, and they were fairly sick at different points in the years, and I had the opportunity to spend a lot of time with them when they were in their hospital admissions. And so I saw what the nurses and the team did for those family members, and I really liked it, and I thought that I could do that as well. And I wanted to really make a difference in the lives of particularly pediatric patients, who had chronic conditions. I like the opportunity to help people in general. And so in clinical practice, I love to see families and caregivers and patients get better, take care of each other, and really ultimately thrive in not their clinical environment, but their home environment. So I'd love to see them go home and do well. In my teaching career, one of my favorite parts of my position in particular is to interact with the students. I really like to see them learn and grow. I like to see them realize what they've learned, have an aha moment, and I really like then to see them in clinical practice. So I do have the opportunity to often see them in clinical practice and really understand how much they have learned in their academic programs. So some of the most valuable advice that I have received as a faculty member has been to enjoy the teaching and don't really stress over any of the small things. You really do have an opportunity to share your knowledge and influence people in class and beyond. So really take your time and enjoy doing that. There's value there. So the advice that I give to a new faculty member is that, as you transition to a different role, coming from an area where you're an expert or, known to be an expert, particularly probably clinical practice, and now you're engaging in a new environment, you're now in the academic world, you're a novice. And so you need to be able to allow yourself that grace to be a novice in a new profession. And I would also say that one thing you could do is, as you get your evaluations and you learn what your students liked about your course or didn't like about your course, there's always a nugget of information that you can say, okay, yeah, there's that element, I'm going to make it a singular change. Don't make a ton of changes because you just want to take it slow, and you will be able to grow and thrive in that new environment and ultimately become an expert there as well.